My name is Dr. Frank Vicini. I'm a radiation oncologist for PrecisCa USA. I primarily treat breast cancer and have been involved in multiple studies looking at the treatment of breast cancer with radiation therapy. If you undergo a lumpectomy, typically that is followed by radiation therapy to the breast. Now, this is based upon the studies that established the equivalence between breast conserving therapy, that is lumpectomy, with radiation therapy versus mastectomy. In those trials, we saw equivalent control of the cancer, no difference in survival, but the radiation therapy was delivered after lumpectomy over a period of about 5 to 6 weeks. Now, through the years, we've attempted to determine whether or not we could either reduce the overall treatment time with the radiation therapy, or in some cases, completely eliminate it. The reason for that is not all patients have the same risk of the cancer coming back after lumpectomy. In other words, the importance of the radiation therapy can be more or less in certain patients. So through the years, we've tried to determine whether or not there are certain patients who do not need radiation therapy at all. There have been multiple studies that have been designed to look at this specific issue, multiple prospective randomized trials, almost a dozen or so through the years, and they've attempted to identify those patients who do not need radiation therapy or benefit very minimally from radiation therapy. Now, those patients typically are the ones that have smaller tumors, lower grade, negative margins at surgery, negative lymph nodes, estrogen receptor positive. So in those subset of patients with lower risk factors, lower factors for the cancer coming back, we can not deliver the radiation therapy because the risk of local recurrence with or without the radiation therapy is very similar. So whenever we have a patient with low risk features after a lumpectomy, we discuss with the patient what the potential advantages of the radiation therapy are in terms of lowering the risk of local recurrence, the cancer coming back. And in some cases, the impact of the radiation therapy is very small, in which case a patient may wish to forego undergoing radiation therapy. So in other words, there are a subset of patients who do not necessarily require radiation therapy after lumpectomy, but that's a discussion that has to be had with the radiation oncologist after all the pathologic findings are available after the surgery.